Hey guys, welcome. So glad to see you. Miracles, Magic, and Coffee time with me, Ralph Havens, and Dr. Tom Giammatteo. Jen is downstairs, so she is always with us energetically. And so welcome. And let me just share this around our different places. Let's just share this to Facebook. It's going to be on our Facebook Beyond Limits page. So look for us there. It's also, of course, here in the YouTube. So look for us here, and click like, click share. Tell us what you're up to. I'm gonna just put miracles, magic, and coffee. Ralph, and Dr. Tom. There he is, Dr. Tom. All right. I think today's show is going to be on the liver, anger, and codependency. Let's spell that right. Codependency. Spell that. There we go. Okay, so ask us anything. So yeah, let's just make sure everybody's good here. We got that. Okay, so we are on. Yeah, so I will keep the YouTube open. So leave your comments there live. Leave your comments and questions here. Dr. Tom and Ralph. So years ago, back in February of 2000, I started taking classes from Sharon Giammatteo and Tom Giammatteo, Dr. Sharon Giammatteo and Dr. Tom Giammatteo, and Iolette was there. Iolette, Sharon's daughter, and it really opened my eyes to healing. And along the way, I've had many great teachers. And one of the classes is on the liver. And another one in the 110 classes that I took, there's even more than that, is on anger and codependency, letting go of anger and codependency. And so I thought that could be a good one today. Sometimes anger has a codependency component to it. And so, so we'll see what Tom has to say about that and some ways to work on that. While we wait for him, I think what I'm going to do is have you, if you're watching live, comment and let us know what you would like for the show. If there's a question you have for your healing, for your health, let us know, because this show is for you. We want to do things that you want help with healing. Let's see, I'm just sorry about all this. I'm putting all these into the different lists as we kind of get set. So all little housekeeping. And one thing that I noticed, years ago when I we used to do these detoxes. Metagenics has a detox called Ultra Clear Renew, and we would add in something called Ultra Inflamex and Advoclear. And there's a specific way to do it with Metagenics, but we're using a version that was with a guy from Houston, a Dr. I forgot his name now. I don't remember his name, but he was getting really good results helping people get over very, very significant health challenges, the worst of the worst. And he had this one protocol that he used with their supplements where you would eat one green vegetable, like say broccoli, and the next day you would eat another green vegetable. It could be broccoli again, or it could be Brussels sprouts, or it could be kale. But the rule was to eat one green vegetable per day, and you could have as much apple juice and organic pear juice as you wanted. And then to take these supplements that helped detox. And the idea was some of the supplements pull the toxins out of the body. And of course, going on a fast like that with not a lot of food broke up the fat cells and pulled a lot of toxins out of the body. And then the next phase of the supplements would help to metabolize these toxins. And the next phase of it would help to eliminate it. So, one of the dangers of doing fasting. We're now right now intermittent fasting is one of the big things to do. And one of the dangers of losing weight or detoxing too much, there's that smart niacin detox of Britt Bowers, which is awesome. Using a sauna and supplements to help detox. But the thing is, the toxins can get released from the fat cells. So as people lose weight, as people detox, a lot of toxins can get released. But the thing is, if they keep circulating through the body, they can cause all sorts of problems. So if they're stuck somewhere in the fat or in the bone or some kind of like connective tissue, they're kind of safe in that your body has figured out a way to wall them off. But I know one person who tried to do a niacin detox on her own, and it was not good. And what she had show up was a lot of suicidal thoughts and lots. I mean, I was like, oh my goodness, what are you doing over there? And so I emailed back and forth and found that she was trying to do this detox all by herself. And she was releasing a lot of junk, and she had a lot of injuries from all sorts of things that had happened to her medically, actually. Lots of chemicals that had been put in her body, and lots of vaccines because she was traveling as a little girl. And bottom line is she had a lot of chemicals in her body that were getting released. And when they started to get re-released, brought out of her connective tissue and her fat cells, and she was doing this niacin detox, it brought up a lot of really bad thoughts. And we had to pull her back out of that and say, don't do that on your own. And so she stopped and she got herself back. And so there's a benefit to getting toxins out. But the thing is, if you just get them out and they start circulating through your body, that's not good if you don't have a way out. So when people are doing intermittent fasting, it can be really useful. And when people lose weight, it can be really useful. And when people detox, it can be really useful. But if you feel brain fog, if you feel sluggish, if you feel really, really bad thoughts come into your world, or all sorts of your past emotional, mental stuff starts to come up, it might be that you're detoxing too fast and you're not having a way out. I think I see.
To type 1.
1 second, Ralph.
Okay. So I'll mute Tom for right now. So as Tom gets on, we're going to ask him about the liver and some of the non-physical things that the liver does, and see what he says, or anything else that he wants to talk about. So let's just bring him on. Oops, sorry, I just I messed you up again, Tom. If you're going to unmute.
Hey, Ralph, how are you?
Good. So I'm open to anything you want to talk about. First, a joke, since it's such a serious day for so many people. I just got word that maybe this isn't true, but what's faster than a cheetah?
What's that?
A cheetah on a bicycle.
Okay.
I have a friend downstairs right now that she goes, I don't know if it would actually be faster. So we're not sure. We'll have to test that. I'm not sure. But anyway, so good to see you. I'm open to anything you want to talk about. What showed up earlier in our other podcast, the End Anxiety and Depression Forever podcast, was stuff around boundaries. And so many people are on edge right now and feeling stressed out. And sometimes it can show up as anger or pushing into somebody else's boundaries. And I thought, well, we have the liver class, and we have the integrated manual therapy and the letting go of codependency and anger class. So I thought that might be a nice thing to talk about, but really anything you want to talk about, of course.
Okay. Well, last night, a couple things happened, right? January 15th, Mercury started its shadow into retrograde. So, and by the 30th, it will be fully into retrograde. So that's really causing some havoc and panic out there in the world. And I feel that our media has been driving us super crazy.
They sure have.
And with this of other people's energies, we've discussed a thing called the Limbic System before. And just a reminder for everybody that the Limbic System is part of the primitive brain, right? It is the primitive brain, and when we're talking about human anatomy, it can go from the primitive brain up to the midbrain and then up to the cerebral cortex, which we feel, you know, if you study anatomy, that feels that it's bringing in human consciousness. But every animal that has a spinal vertebra has a primitive brain. So our friend and one of our teachers, Frank Lowen, used to say, you know, when we're in our primitive brain or our reptilian brain, you know, there's a survival mode, and the limbic system actually only sees in pictures. So it needs to survive, it needs to propagate, but it needs to fight, but it also brings in joy and sorrow at the same time. So I feel like the media has learned how to stimulate the primitive brain and make it really pissed off and angry. So it's really coming in, and maybe if we can teach everybody a little bit of body work on how to deactivate the limbic system, that would help a lot too.
I think it will. Yeah, I think it's so needed. Even if people may not be watching as much news as other people, it seems like there's a lot of messages going back and forth. I've been talking to different people, and where people are really lashing out hard against other people. And of course, it's like, well, they're kind of like they're backed into a corner, like an animal backed into a corner. They can lash out. So yeah, I think it's a great thing to talk about how to pull some of that out of us or down or clear it or body work to shift it.
Okay, so first piece is that on the 15th, on Friday, I wrote a paper on Mercury going into retrograde a little bit. And it involved an area in our body which we love to call the Ileocecal Valve area. And that's located right in your right hip pocket, right? So if you slid your hand into your pocket and you pointed your fingers towards your bladder, you'd be right over your Ileocecal valve. And we found that an area where people have been feeling, we call it a victimizer energy, where there's people feeling like, why is this all happening to me? Instead of taking responsibility of, why did I pick a time to be in this time?
Yeah.
So if you're blaming, you know, why are the bills so high, or why is this guy doing it to me? Why is the government doing it to me? You may have a little bit of this victim energy coming up. And it really gets even more heavy when people are eating gluten.
Yeah. So, and that is the energy that I'm seeing. And that's what Katie was talking about this morning too, from the End Anxiety and Depression group. And yeah, it seems like people are lashing out and accusing people of harsh or mellow, you know, accusing people of being the problem for them.
Yeah. And it's a time where we're going to really have a lot of this perception, like people are picking on me, and I'm why always me type of thing. And just be aware that everybody's feeling it in the world. So, you know, we're not the way the media is portraying everything, it's all focused on the United States, but other countries in the world are actually having upheavals.
Yeah.
My wife is from Russia, and she received from her brother um, a YouTube letter saying that there will possibly be a very strong protest on this Saturday.
Yeah. And I've been seeing things in Germany and Toronto, and I know our friend in Slovakia is reporting on what's going on. It's really very aggressive stuff going on, but there's also a lot of protests, not in the United States so much, but there's a lot of stuff going on. And you're talking about the military going to be all over Washington, D.C., like getting used to the idea that the military can walk around our streets. It's like, that's getting weird.
Right. So if we want to deactivate our limbic system, taking it, the one hand on the forehead between eyeballs, and then bringing it to the heart and holding that for 10 minutes will bring circulation for all the times where, you just did this when we were talking, when you're looking into the screen, your eyes crunch down. So that forces us to be more limbic or more irritated on the whole piece. And then dropping it down to our belly button and holding that area to the bridge of the nose again, and then to the bladder should get us a little bit more grounded in that piece of just being able to take a breath. And if you're having sleepless nights, this is a good protocol. So bridge of the nose to the heart, to the umbilicus, and to the bladder will really help that piece out.
Like about, you said as little as 10 minutes per person, per person.
Yep. Yep.
What do you think of this guy's eyes?
Pretty fascinating, aren't they?
Yeah.
Yeah.
Because there are people that seem to have transcended that, and the enlightened people.
Yeah. So if you got creases in your eyebrows here, that's usually a non, the Buddha would say that this is an expansion area that we can have open up in this area here.
Yeah, integrative manual therapy actually has physical techniques, hands-on techniques to release the cavernous sinus, which I know has been talked about in IMT is like a consciousness thing, and the pineal gland and the thalamus for perception. And we actually have techniques to unlock it. And the spheno-basilar junction. What happens when those areas are just manual therapy, just improve the structure and the function in that area physically? What do you notice that happens when something happens when we work on that?
Perception, connection to God is a lot deeper. Consciousness is a lot deeper with those pieces too. Over the number of years, I've had many high religious people come in so that they could get better meditation, so that they could sit in the yoga positions or the meditative positions, and even opening this whole piece up so that they can perceive more and hear more and see through what they call the third eye of the person at the same time. So for the normal person, it would make you less anxious, less grumpy into those, and even be more perceptive, like things you can start to hear other people's thoughts maybe. It's kind of cool.
Yeah, kind of cool. And yeah, IMT is such a thing about perception, is we can see stuff, partly because we hang around you guys a lot, and then we trained and get to practice stuff, but then physically just shifting our own bodies with techniques that open up to some of these areas. Is there an area that you can open up or change or shift that activates play? Because I know in the Bible, they talk about to enter the kingdom of heaven, you must be as a child, and children love to play. And in Matrix Energetics, Richard Bartlett talks about the whole key to this thing is pure play, like not pretending to play, not trying to play, but actually playing like a child. Is there an IMT part of the body that you can open up or change? Or is it just a matter of like when I did a lot of I did the metagenics detox a while back, a real strong version of it that I was talking about earlier, and Jen was like, "Oh, I like it when you do your detox," because I was more loving. Like I was just like the toxins were out, and I just felt so happy.
Right. We have, for a lot of people, play is something that they have washed out of their own bodies. So giving them that freedom of movement. And, you've had this happen, and I've had this happen, where somebody comes in with a little bit of back pain or a lot of back pain. And, we do 2 or 3 sessions and they're out of back pain. And then they come in crippled the next time, and you ask them what they did. And it's like, well, I had a garden for 6 hours because I was feeling so good. So that's the type of play that's going on. I had this one gentleman that came for 4 or 5 visits, perfectly fine. Never saw him again about about a year later, he comes back and goes, my back pain's back. And I look, and said, well, you haven't been here in 9 months or a year. And what'd you do? And he said, well, when did your back start hurting? He said, about a month ago. And I said, well, what did you do? And he said, well, I flew to Russia, took a 2-day bus, a 3-day train, and then I cross country across Siberia with an 80-pound sled on my back, and came back has a little bit of back pain. I said, oh, I think that's overdoing it a little bit on the play pieces. And then you've told the story before of Allie, who was this 17-year-old girl that was in a wheelchair because she had a spinal cord injury, and her accident was diving into a pool. And about a month later, she was paralyzed, and she had been hospitalized for 3 or 4 months in a psychological hospital, saying it's all psychological. And we did our body diagnostics, and we found that she had a stroke in her spinal cord. And when we repaired the artery that was in the stroke, she stood up, and that she did 3 cartwheels right down the hall.
What was it like in the clinic? Was that San Francisco or was that Connecticut?
That was in Connecticut. They had flown out here to do that piece.
What happened as that happened in the clinic? Like, you guys probably had like 10, 15 therapists working there at the time or something like that, right?
Yeah, we had our big room with 14 tables in it, and she gets up off the table and says, I feel, she's able to stand up on her own strength in her legs. Took a few walks down the hall, and by the afternoon she was jumping and smiling and feeling really good. And
what was the mood like in the clinic? What was everybody doing? How was it?
Well, you've experienced it before. IMT is a community process, and we really don't Western medicine makes you feel shame that you got a disease, and integrated manual therapy finds a problem, just like, okay, your tire's worn on one side, let's replace it, or let's fix that up. And are you back here? There we go.
Yeah.
I just have another clinician calling in, so I'll call him back in a minute. So if we can find structure and we can say that we can help stretch it out, fix it up, then it's not about the shame of having a disease. We've been really programmed in Western medicine to think, okay, I got shingles now, or I have this, and it's always this bad guy. Instead of, give me 1 second.
Yeah, instead of, it's just like, you just need to find out where the issue is and how to clear it, how to shift it. And Sharon used to always come in, and we would do our diagnostics, and then when we were right, or when we got the plan, or when it showed up that, oh, this is what you need to do, she would actually say, okay, fix it up, and walk away. She actually used that word, and we all know it's like it's healing it's like it's from God. It's like, if the person was dead, you couldn't say fix it up. Maybe you could if you were Jesus or something, but yeah, there's a thing about IMT. It's like a way to find it and then fix it up, and then see a measurable change right there. I wonder, yeah, we've got the liver. Can you talk a little? Well, it's like, I guess people don't have to know how it works, because it's like we don't know how Zoom works, but we can use it, so we don't have to go and figure out like how does Zoom send it over the airwaves. It's like, so it's like, how does IMT work? That's not the important thing. If you're not used to these kind of ideas, it's just that you're not used to these ideas and you haven't seen it. When you've been around it for 20 years, like I have, and Tom longer, we still don't know exactly how it works. Not totally, completely, absolutely, but we know how to push the right buttons, and it's just become a common thing of like, in our reality, these things can heal. So if you're not familiar with it, or if it seems like too weird and you're asking like, how does this work? It's more like, will it work for you? So
yeah. So we always build in the history of a person's not just the moment that they walk in. They're a function of everything that they've done in their whole life.
Yeah.
Right? And so, my evaluation pages are 20 pages of asking questions. Wow. And then we sit there and ask more questions while we're reading through the evaluation. So a week and a half ago, a gentleman came in with 2 years of not being able to sleep, incredible liver pain in this area, barely getting an hour of sleep at a time. And sometimes when he was driving, he'd physically have to roll over and have vomiting. And he went through the major hospital in Hartford. He went through the University of Connecticut hospital. They looked like a number of different things. They said there's no surgical procedure with this. Here's some things. Here's some baclofen, which is really a super strong muscle drug and a pain reduction. And he walked in and he basically said to us, I'm hurting. And we took a listen to his history, and he was a construction guy. And a year and a half ago, he fell and broke his ribs right over. Right. And so medicine didn't have an answer for that. And another time he passed out. So they decided to take out his clavicle and work. Well, he had neck pain, so they gave him cervical fusion. And the next year he had clots going to his arm. And the next year he fell and broke his ribs. So it was like, okay, how about if we get those to move like they're supposed to move? And he's now pain-free, slept 8 hours last night in the first time in 2 years.
And it looked like a medical liver problem. And it was he fell on his ribs. He had this other problem up here. And
yep.
I actually fell about 2.5 weeks ago, just a fluky thing. Jen says, sometimes it's just an accident, Ralph. Maybe it's not like you're on some weird funky thing happened. It was a rainyish day and I was on a trail that I thought I'll take my road shoes because I'm going to be part road, part trails, but it's road shoes that don't have very many grippy things. And I happened to run around this place that had a little mud, and really quickly I went down really hard on the shoulder. And so I worked on it, and it was like, oh my God, I took almost a week off. It was pretty rough, and I was fixing up bone bruises and rib bone bruises and trying to do strain counter strain on myself and having Jen do a 1 or 2 and doing all my other techniques. And it was getting better, but it's still sore. And I was doing stuff though recently that of working on my lung and all sorts of this lung motilities. PFM kept coming out of this lung, and I thought, is this some old grief pattern? Is this some old thing? It's like, it kept feeling like a physical toxin thing. But yeah, so when somebody has a fall or they have some sort of accident and it looks very orthopedic, but then or somebody else has a thing that looks very medical-ish, there's a whole history of what happened and what's how best to fix it. And one of the things IMT does is find the primary thing. Like the primary thing is physical and it's here, or the primary thing is a spiritual thing and it's here, or it's a mental or emotional thing or it's here, and do this one thing here, and then let's see what else unravels. Can you talk about, because that guy came in with a fall, well, he came in with what looked like a medical condition liver, and then you found physical stuff from old falls. I remember there was that one woman that you talked about that came in for some kind of problem, but you found a problem from an old wrist injury and just fixing up the biomechanics of that, just getting it to work. How can you talk about like the primary area? And if you happen to see my primary area, I'll go work on it. But yeah.
I'll text you that in a few minutes after we get off.
Yeah. Thanks. Yeah, but yeah, so it's like it can be such a mystery. Like I have a client that sees me off and on, and has a lot of history from many years of all sorts of stuff, and then now has a hand that's not working quite the way it should be, and she's going through lots of medical tests. I haven't seen her physically, haven't seen her for quite a while, but I get messages every once in a while, and medical system is trying to see stuff like, oh, we see this in the neck, we see this in here, this nerve conduction thing here. IMT has a diagnostic thing, but you guys, we kind of like look for the primary thing. So I don't know if there's a question in there or not, but like talking about like finding primary things. Like for that guy, it was like you fixed up physical rib and collarbone, neck joint things, right?
Yep. And that, that rib injury made him gain 50. if we look at the digestion, how much did the ribs push on the liver, and how did he not be able to digest? And so we opened up his diaphragm so that circulation can go back and forth, and that he's losing weight again with that whole piece. But it's trying to find, if somebody, if you've gone to regular physical therapist or you keep getting the same muscle back, maybe it's not the muscle.
Like if it's the same chiropractic adjustment, the same physical therapy stuff, exercises that aren't really fixing it long term.
I feel that you've been trained this way too. We're always expecting a better outcome and human potential by the time we finish something. And if something back, we may have not used the right tool. So that is also more information. But we don't keep hammering the same tool with the same person.
Yeah, if it didn't fix it with the one time, then you don't just do the same technique again and again, even if it might be something useful. There's something you're missing. There's something that's missing. I think the diaphragm techniques from your red book. Where is that book? This is an incredible book. But the diaphragm techniques from that book, I think you guys should win the Nobel Prize for that, for the diaphragm techniques. That series of 4 things plus the subclavius, that's a huge thing.
I feel if we were helping mankind, everybody deserves to get that technique done once a year to themselves to reset.
It really does. And I sort of have figured out a way, I should do that to myself again, to do it modified to myself. You got to use your own muscles, but it's a technique that you could learn just by looking at the picture and reading the words and figuring it out a bit, and have your partner or somebody do it to you. It's really quite remarkable. And the way I explain it to clients sometimes, and I'd love to hear what you think about this, is we've got this, if somebody punctured your belly, your intestines would flop out. It's positive pressure. If somebody punctured your lungs, it would all collapse in. Nothing would flop out, it would collapse in. So we have a vacuum, negative pressure, right next to a positive pressure, separated by this diaphragm that lets blood go back and forth, and it goes up and down, and it's got a negative pressure and a positive pressure. And if the lungs are working well, then that negative pressure is at a certain strength, and it literally lifts the organs. It like lifts the organs because of this negative pressure. So that the diaphragm techniques from this red book are huge because it balances all these partitions in the body, these diaphragms, and lets the right pressures, because there are different pressures in your head versus in your in your belly versus in your pelvis. So I think that's one of the best. I mean, all the IMT techniques are amazing, but that thing is like incredible.
Yeah, that plus the aorta, because you do your diaphragms first, and then you reorganize the main pipe to the bloodstream, and people get back to the brain, and that's something that I would wish we could teach everybody.
We should do a little video on that, but it's like, man, to teach the aorta one would be a little intricate. To teach the inferior vena cava and superior vena cava would look crazy.
Yeah, well, those techniques are something that I believe everybody should do, and that's classically my first treatment plan, to remind the clinicians to go back to something simple sometimes, and it opens up a lot of different things.
That was our rule set in San Diego with our 5 therapists, was like, everybody gets those done first thing, unless it's like a big mental or spiritual pain that you got to clear first. But
right.
it was like very high on the list to just get done, because I remember when Danielle first, we were all eating lunch, and Danielle had a client in the private room, and the client walked out and left. Hey, see you later. And she came out and like, did you see that guy? Because I guess he walked in all limping and like decrepit, and he walked out just normal. We missed the pre-test. Anyway.
Well, if everybody can, because of the anxiety going on, remember the bridge of the nose to the heart, to the belly button, and the bladder, holding those connections for 15 minutes each. Or if you wake up in the middle of the night with a bad dream, those are all wonderful pieces to calm us down in this crazy piece here.
Yeah. What do you think of this one for somebody, the liver strain, counter strain, slouch, turn to the right, 30 degrees, bend to the left, 35 degrees, and stay there for a minute or 2 minutes. I find that one is a nice way to let the liver have a little motion.
Yeah, well, I've sent them to you, but I'll resend them to you. That probably in August, I rewrote self-strain, counter-strain for the release of the liver on the diaphragm. So the whole diaphragm's released. There's 5 techniques that
You
I
sent
could
them, and I know it would be hard for me to find them. So yes, thank you for sending them again. I really appreciate that a lot. I'm going to do those because that could actually probably help my shoulder. But I'm that's just so important. And I I know it's getting close to the end of our time today, but I think this is the correct take on this. But let me know what you think. I know you and Sharon worked with and worked for Upledger's group and John Pierre Barral, and I took the techniques through the advanced levels of those visceral manipulation classes of Jean Pierre Barral. And there was all these intricate techniques to release the liver to get it to be able to move in all these different directions. And from my understanding is the strain, counter strain, these simple positions do the same thing as all this advanced stuff, or how is that?
Well, again, it's the tools in the right hands in an efficient way. Jean Pierre Barral's visceral manipulation is a very good tool, and a lot of people studied it. But again, if the injury comes back, if the same phenomenon comes back, it's not the right tool, and it is a manipulation tool. So Jean Pierre's are fascial releases of the organs, and you know as well that every organ can have a biomechanical issue, a lymphatic issue, a blood supply issue. So which IMT brings to the table is that, okay, I do one fascial release, I do one of these, but at the right time, the right tool should release. But if it keeps coming back and somebody keeps having a left kidney stuck,
Yeah.
so it's, I think the best thing of IMT is it says, okay, did I resolve it? If not, what does that tell me? If it keeps coming back, what does that tell me what I'm not finding?
Yeah.
So
That's the key piece. Yeah, it's like it might be a certain liver technique is useful, but if you have to use it again and again, there's something else that's there.
yeah, I respect the forefathers that came before us and developed. You know, they were all gifted people that God helped them, you know, deliver this energy to the world. And you know, it's hard to teach that. But what I hope IMT does is make a clinician or a practitioner that's always asking, well, I didn't get it right. What else is there?
Yeah,
Right.
that's it, man.
And, you know, I always like the therapist that says, I couldn't find it and I need some help. And I always work, you know, in my office, I have Nancy and a couple others, and I don't proclaim that I can see everything every moment of the time. And it's a learning opportunity. So everybody has their specialties. Some people see food as their healing tool, and it's always nice to learn and do a development piece of it. But IMT, I feel, is a, you know, global respect that it doesn't, if something doesn't work, and it's not the patient's fault, it's my fault that I didn't know what to do.
Yeah, just another learning piece. Yeah. Yeah. So I want to just give this your contact info, imtwellnesscenter.com, imtwellnesscenter.com, based out of Hartford, Connecticut. But you can get on the phone with Tom, and he'll do a free 15-minute consult, and reach out to me. There's numerous ways to reach out to me. So look for that. You can find us on the YouTube Beyond Limits and the Facebook Beyond Limits. And yeah, and autoimmuneanswers.com is a place to find me. So yeah, reach out to Tom, imtwellnesscenter.com. Again, thanks again, Tom. Amazing. And it'll be cool to see you next week. And everybody just leave us some messages. Let us know what you need, what you want. We appreciate you being here. And there is an answer. So if you've got something going on, reach out to us. Reach out to us and let us know.
Thanks, Ralph. Good to see you. And I'll text you your tools.
Thank you, man. I really appreciate that. I got to just give a giant shout out. Tom will send me stuff about what's going on, and then he'll give me my homework. So we can do that for you guys too. So